Hello everyone, my name is Devanshu. In this video, we're going to start our new series. So from this series, we're going to start the autonomic nervous system, general considerations part, other parts that is parasympathomimetics, parasympatholytics, sympathomimetics, sympatholytics. These topics will be discussed in further classes. So in this video, we're going to learn the autonomic system, what is an autonomic system and the part of it. Okay. So the general consideration, the basic things, the basic concepts will be discussed here. So let's start. So why autonomic nervous system? Why should we need to learn these things? So why is it so? Because it has a high weightage topic. Every year you will see around 1 to 2 questions coming from this topic from ANS in GPAT and NIPER exam or any other competitive exams also, especially important in CNS, CVS and respiratory drugs, because the concept you will learn from here, that concept will ultimately useful for you in these topics, CNS, CVS and respiratory drugs. In other chapters also you will see, and also you will see your foundation building, because many of the question will be asked from the ANS receptors. ANS receptors, that is beta 1 receptors, beta 2 receptors, alpha 1 receptors, alpha 2 receptors, muscarinic receptors, nicotinic receptors. Okay. Also the drugs which are acting on these types of receptors, that is atropine, epinephrine, which is also known as adrenaline, propanolol, which is a beta blocker. Okay. So these ANS system helps in predicting the drug effects, side effects, also the mechanisms. Once you learn the mechanism of these receptors, ultimately you will be able to learn those drug effects in upcoming classifications. Okay, so repeated in PYQs, previous year questions, GPAT and NIPER exam frequently repeat concepts like difference between sympathetic and parasympathetic systems, drug acting on cholinergic and adrenergic receptors. You will see the classification questions coming from directly from the classification onwards, that is which is the indirectly acting cholinergic drug. Okay, so what is the drug acting on the beta blocker, beta 2 receptor, beta 1 receptor. Okay, so these types of questions that may be asked from you on these types of exams, that is GPAT, NIPER and pharmacist exams. Okay, so let's start. Shall we start? Yes, we should start. So let's divide these types of nervous system in different types. So everyone knows there are two main nervous system in our body. First one is central nervous system and second one is peripheral nervous system. Central nervous system belongs to only brain and spinal cord. But if we talk about the peripheral nervous system, it is further divided into two parts. First one is autonomic nervous system and second one is somatic nervous system. Automatic, not it is automatic, it is autonomic nervous system. Autonomic nervous system is belongs for the involuntary actions, involuntary movements inside the body, involuntary programs in the body. We do have a programs in our body. So that kind of programs can be controlled by autonomic nervous systems. Okay. Voluntary actions are controlled by somatic nervous system. So we're not going to learn too much about somatic nervous system here because it has a separate chapter. After some time we will learn that. But in this topic, we need to learn what is parasympathomimetic, parasympatholytic, sympathomimetic, and sympatholytic. Okay, so these are the parts of two parts of autonomic system. First one is parasympathetic system and second one is sympathetic system. In parasympathetic system, you will just do what? You will just calm, relax, composed. But if you talk about the sympathetic system, it is all about the fight and flight conditions, emergency conditions. You are running all the time, you are having stress, you are having adrenaline in your veins. So these types of things comes under the sympathetic system. Okay, so let's move on forward. The autonomic nervous system is an involuntary in nature and the activity of the system is maintained automatically. Okay, autonomic nervous system is involuntary in nature, as I told you before, and its activity of the system is maintained automatically. You have not control over yourself. Okay, you can't control your heartbeat. Okay, you can't control your blood circulation. You can't control your respiratory actions. Okay, you can't control your breaths. Okay, so these types of things comes under the autonomic system. nervous system. Okay, so ANS has two divisions. First one is parasympathetic and second one is sympathetic. The sympathetic is more widely distributed than parasympathetic because parasympathetic will control only your eyes, head and neck, and the trunk part. That is trunk part, which includes GIT. But rest of the parts of the body are controlled by sympathetic system only. Okay. So there are some ganglions, preganglions and postganglions. In between, what is that? In between, there is a synapse. Everyone must have known about that. But in both the cases, if we talk about the in the parasympathetic system or sympathetic system, the length of these ganglions may vary. So this comes around your exams, and have been asked in your exams previously also. That one of the question I remember, that what is the length of your postganglion fibers in parasympathetic condition. So answer is postganglionic fibers are very short in parasympathetic system. So from here you can see parasympathetic system. This is the system parasympathetic, that first one. In parasympathetic, first one is preganglionic, this middle one is synapse, and afterwards this is a postganglionic. Okay, so the question was asked that in which of the following the postganglionic fibers are very short. So in the parasympathetic system, postganglionic fibers are very short. You must have learned that. Okay, you should learn that postganglionic fibers of parasympathetic system is short. Okay, so you can learn it through post short for parasympathetic, post short for parasympathetic, post short. Okay, you can learn from this. Apart from this, you will have sympathetic nervous system. In this area also you will see the preganglions and postganglions, but here you will see the postganglions are very long. The postganglions are very long. Okay, but you must see in every condition you will see acetylcholine as a primary neurotransmitter. A primary neurotransmitter in every case, in parasympathetic also, in all the sympathetic condition also, and in somatic nervous system wala preganglion also, you will see ACH in every condition. Okay, but if we talk about the postganglionic condition, this may vary according to their sympathetic or parasympathetic outflow. Okay, so in the parasympathetic outflow, you will see the acetylcholine is also acting as a secondary neurotransmitter. Here, primary neurotransmitter and as secondary neurotransmitter, and then acting on the M, that is muscarinic receptors. Okay, then in sympathetic condition, you will see acetylcholine and the noradrenaline. Noradrenaline is acting on alpha and beta receptors. Okay, in the same way, acetylcholine, dopamine is also a neurotransmitter which is acting. So it acts on dopamine 1 receptor. Okay, then acetylcholine also acts on the muscarinic receptor sweat glands. Okay, this sweat gland, that is sweating. Sweat glands do what? Sweat glands will secretes the sweat, and this comes under the sympathetic nervous system, not in the parasympathetic nervous system. Okay, it should be noted that sweating condition comes under the sympathetic condition. Okay, so these secretions, sweating, will ultimately release whenever you will be in the stress condition, and the stress condition belongs to sympathetic condition. Okay, then also in the acetylcholine acting as a short preganglionic neurotransmitter, also it goes around the adrenal medulla. Adrenal medulla is responsible for the release of adrenaline from adrenal medulla. Okay, so, and next we should talk about the somatic system. Somatic system is basically controlling the skeletal muscles. Okay, the skeletal muscles has which kind of receptor? NM receptor, that is neuromuscular junction receptor. So in the condition of somatic system also, acetylcholine will work as a primary neurotransmitter. Okay, so in this slide, this division of autonomic nervous system is very important. You should have learned that in parasympathetic nervous system, postganglionic are very short. Opposite of that, in the sympathetic nervous system, the preganglionic fibers are very short. Okay, post are short in parasympathetic, pre are short in sympathetic. Acetylcholine is the main neurotransmitter in every condition, whether it is parasympathetic condition or sympathetic condition. Okay, so let's move forward now. So, parasympathetic originated from the craniosacral part, craniosacral, that cranium wala part, and then goes around the sacral curve, sacrum part. Okay, and if we talk about the sympathetic, the origin comes from the dorso. Dorso is thoracolumbar. This dorso or thoracolumbar. Thoracic curve is also known as the dorso curve. Okay, so thoraco to lumbar. This from this to this, it is the origin of the sympathetic nervous system. Okay, so as I've told you before, that parasympathetic condition is limited to head, neck, and trunk part only. Okay, but sympathetic system is distributed to the all over the part. Okay, and then the neurotransmitter acetylcholine as a primary response uh, neurotransmitter comes under the parasympathetic nervous system. But if we talk about the sympathetic nervous system, which is the nerve ending part, the noradrenaline will be the major neurotransmitter in sympathetic system. If you can see here, that noradrenaline. So how will you decide that what is the major neurotransmitter? Okay, from the secondary nerve, that is the postganglion. Okay, that postganglion will be the your major neurotransmitter. Okay, in parasympathetic case, acetylcholine is the major one, and in the sympathetic, the dopamine, noradrenaline, and sometimes acetylcholine also will be a major major neurotransmitter. Okay, so the main function is to keep body cool, calm, composed, relaxed in the case of parasympathetic nervous system. But if we talk about the sympathetic system, it prepares your body for fight and flight movement. This term is, I don't know how many times it comes under the exam, that which kind of nervous system is responsible for preparing the body for fight and flight condition. So the answer will be the sympathetic nervous system. Okay. Now there are some actions of autonomic nervous system. Okay. So let's discuss. So what are the action of sympathetic system and the parasympathetic system? So in the cases of heart, that is heartbeat, in sympathetic system, it will what? It will increase the heart rate because you will be in the stress, you will be in the emergency condition. Your heart rate will be ultimately what? Increased also. So here, heart rate will be increased, contractility will be increased, and the conduction from SA node to AV node, and then bundle of His and the Purkinje fibers, that conduction of that from SA node will also be increased. And that will ultimately leads to what? That will ultimately leads to contractility, and this will leads to the heart rate, increase heart rate. Okay. Whereas in the case of parasympathetic system, you are in the relax. You are not in your stress mode condition. So here there will be a decrease in your heart rate. Okay. So if we talk about the bronchus, that is respiratory rate. Okay. So at the time of emergency, your bronchodilations occur because you need lots of air around your lungs to be inhaled. So your bronchioles dilate to inhale lots of air in it. Okay, so that kind of space are needed. So that is why these bronchioles are dilated in the case of emergency condition or in the sympathetic nervous system. While in bronchoconstriction, while in parasympathetic nervous system, these bronchioles are constricted and minimizes some energy loss. Okay, so what about the GIT? The motility, the defecation process, the urination process are also decreases at the time of at the time of sympathetic nervous system. So when you see a lion around the road or somewhere, you may see a snake. So at that time you will be in the stress condition. You don't have time to pee. No, you don't have time to defecate. So at that time, that GIT movements will be low down. But at the time of parasympathetic nervous system, you are taking a lots of water, you are lying on your bed, and ultimately you will see a signal through your urethra that you need to pee, right? So the stimulation in GIT, that is peristaltic movement or the defecation movements, are increased. In the same way, the bladder urine outflow also increases. The 1 number and the 2 number also increases at the time of parasympathetic nervous system. Okay. So in the pupil, you will see a snake. So what will happen? If you see a snake, your eyes will be dilated. Your eyeball is dilated. No, the dilation process is mydriasis. Okay. So how will you learn? You can learn through sympathetic SY and MY. SY and MY. Mydriasis is related to the sympathetic nervous system. Meiosis is related to parasympathetic nervous system. So the dilation of pupil is mydriasis. Okay. So how it is occurring mydriasis, how mydriasis is occurring, we'll discuss in later parts, in the later classes. Okay. But what is the term exactly related to the sympathetic nervous system of pupil is mydriasis, MYSY. Okay. And the constriction of mm, of your pupil is meiosis. In parasympathetic system, you will be relaxed in mode, and what you will do, you will try to sleep at that time. Now, so automatically your pupil size will be decreased. Okay. But at the time of glands, okay, what will happen to your glands? It will also decrease your secretions in sympathetic system except sweating. Okay. Except sweating. But if we talk about parasympathetic system, the secretions will be increased. It is saliva, lacrimation, urination, defecation. This is increased. Okay. So these are some actions of autonomic nervous system. Okay. So now let's move towards some questions for you. So let's start with the first question, that what is the correct statement regarding the parasympathetic system? So the first one is preganglionic is short, preganglionic is long, postganglionic short, or postganglionic long. Second question is the primary neurotransmitter released by preganglionic sympathetic and parasympathetic neuron is dopamine, norepinephrine, acetylcholine, or serotonin. You have 10 seconds to answer to these two questions. So time starts now. Okay, now let's see the answer. So the answer is postganglionic short. No, short. It is made by mistake, not this one. So the answer is post short. Okay. The postganglionic fibers in parasympathetic nervous systems are short in nature. Okay. So the next one is the primary neurotransmitter released by preganglionic sympathetic and parasympathetic neurons is acetylcholine, as we have seen before also. So the next question is the sympathetic nervous system originates from which regions of spinal cord? First one is craniosacral, cervical thoracic, thoracolumbar, or lumbosacral. Second question, which of the following is parasympathetic response? Increased heart rate, bronchodilation, relaxation of urinary bladder, and increased salivary secretions. You have 10 seconds to answer. Okay, so now let's see the answer. So thoracolumbar or dorsolumbar, these are the sites from which the sympathetic nervous system originates. And second one is the increased salivary secretion. Saliva are the parasympathetic response. That is SLUD, saliva, lacrimation, urination, defecation. Okay. So these are the questions for you. Which structure act as a major integration center for autonomic functions? Dual inversion of sympathetic and parasympathetic systems is absent in heart, eye, blood vessels, or lungs. So these are some tricky questions. You need to learn and find these answer and let me know in the comment box, and we will discuss in next class. So this is all about the video. I hope you like it. I hope you get the basics of autonomic nervous system. We will start the cholinergic system, that is parasympathomimetics, in next class. So this is all for today. Thank you so much.